Hello, everybody. How is everyone doing today? I pray that everybody is doing well. You guys are staying safe. We thank God so much for allowing each of us to see this beautiful day that He has made. Our weather is starting to break. Hopefully, this trend will stay as it is and continue for the remaining days. First of all, I just came from work and my kids are home. So, if there is any interruption or you may hear them talking in the background, please, I apologize and just ignore the noise from my background. So I'm back. If you are watching me for the first time, my name is John Jay, and I have a YouTube channel called Health Talk with John Jay. So I'm pretty much just bringing every now and then little tips here and there on different health issues, steps that we can take to live a healthier life. Okay, because this body that we have, it is the temple of God, and it is our responsibility to manage it properly and to make sure that it's well taken care of, not just spiritually for those of us that are believers of Christ or Christian, but also physically. It's our responsibility to take care of our health so we can live a fulfilling life and live a long, healthy life. So last week I said that February, the month of February, is National Heart Awareness Month. So in the month of February, more focus is paid towards heart health, tips that you can do to keep your heart healthy. So we are still in February. Oh my goodness, I think my baby is heading downstairs so I can hear her iPad noise in the background. So we are saying, hey guys, can you, Hannah, can you lower your volume, please? Yes, so we are in February. I'm so sorry. I hope her noise is not too distracting in the background. So we are still in February. So I'm still gonna be discussing, about the heart. So I talk about heart disease last week, and then I share different steps that you can take to keep your heart healthy, and I also gave you guys one of the main risk factors for heart disease. So when we hear the word heart disease, sometimes you wonder, what is heart disease? Is it one specific disease? What is heart disease? So when you hear heart disease, it's pretty much a general term for many different diseases or conditions that affect the heart. It's not one specific disease. There are a lot of other diseases that affect the heart. So heart disease is just that general terms that covers all those different diseases. So today I'm going to be discussing with you the most common heart disease. So the most common heart disease is called coronary artery disease, or the abbreviation is CAD. So what is coronary artery disease? So it's pretty much a condition that affects the blood flow to the heart. So how the blood is flowing to the heart. So with coronary heart disease, you have less blood that is flowing to and from the heart. So, and when you have a decreased amount of blood flow to the heart, it can lead to heart attack. So that's why coronary artery disease is so important. All right. So another name that you will hear in terms of coronary heart disease or coronary artery disease is ischemic heart disease. And what causes this heart disease? This is caused by plaque built up inside the walls of the artery that supply the heart with blood. Plaque built up inside of the walls of the arteries that supply the heart with blood. So our heart, it needs blood, and not just regular blood. It needs blood that is rich in oxygen in order for your heart to work effectively and efficiently. But when you have plaque built up inside the walls of the artery, it makes it difficult for the heart to have enough of this rich blood going to the heart. So when you hear the word plaque, let me see here. I try to get a little image here. So I don't have no copyright to this image. I just printed it from on the internet. This is your heart right here. And this pink lines and stuff that's running here, that's the artery. So if you look down here, you can see this little yellow build up right here. This is plaque formation. And this whole circle here is inside the walls of that artery that supply the heart with this oxygen-rich blood. So when you have too much of this plaque built up in there, guess what it does? It makes that artery wall narrow. And by it being narrow, there's less blood being supplied to the heart. Okay, and what causes this plaque buildup? So plaque is simply made out of cholesterol. All right, so cholesterol, and most of our food that we eat as Africans is high in cholesterol. We eat the palm oil, you know, all those things, they are high in cholesterol. Right, so if you want to know some of the symptoms of this coronary artery disease, what will you be experiencing if you have coronary artery disease? So the first symptom is chest pain. Anytime you have, like if you have chest pain or chest discomfort, that's the most common symptoms of something going on with your heart. Now, mind you, chest pain can be caused by other things too, like if you have gas, you know, and it travels to your chest, it can cause chest pain. But there's something that's very, very specific about this type of chest pain that will tell you if it's related to your heart or if it's related to gas or if it's related to muscle pain. All right. So if you have this chest pain that feels like almost an elephant sitting on your chest, sometimes it radiates to, especially for men, it radiates or it travels to your left shoulder. You may have this pain in your lower back. It's constant. It's not going away. It's there regardless if you take deep breath or not. This pain is just there. So chest pain is the most common symptoms. And then you may also have weak. You may also feel weak. You may feel lightheaded or dizzy. You may feel sick to your stomach, like you want to vomit. Or you may start breaking out in cold sweat, meaning you will be cold, but you will still be sweating at the same time. All right. And like I said earlier, this pain can either travel to your arm or your shoulder and can make you short of breath. It will make it hard for you to breathe. So if you're having any of those symptoms, please do not delay. You want to be either calling 911 for emergency medical care, or you want to be heading to the hospital as soon as possible. Okay? So the question is, how can you be healthier if you have coronary artery disease? So there are simple steps that we can take at home ourselves in order to live a healthier life. So if you've been told you have coronary artery disease or you're being treated for coronary artery disease, there are some things that you on your own can do at home to keep your heart working healthier. So first thing, as I always say in most of my videos, is lifestyle changes. We got to start by eating right, eating healthy. Don't eat too much salty food. Eat a low-fat diet. If you are not exercising, exercise is important. Try to incorporate exercise in your everyday life, even if it's walking for 30 minutes or 15 minutes, 3 days a week. If it's too cold outside and you don't want to walk outside, you can just do little things in your home. Put a YouTube exercise video on and just do some type of physical activity. If you want to also try to maintain a healthy weight. All right. And you can work with your doctor, your nutritionist or dietitian to kind of help you decide what is a healthy weight for you. Because not everybody meant to be fat and not everybody meant to be skinny, but there's a weight based on which is individualized for everybody based on your height that's considered healthy for you. So you want to work with your healthcare provider to decide what is that healthy weight for you. All right. So, and also if you are a smoker, please, that's a very dangerous habit. And yes, I understand it is something that is very difficult to break. But every little steps that you take day by day, you can be successful in that. So, you know, there are different programs that will help you in order to be successful in quitting smoking. So again, in order to be healthier, living with coronary artery disease, these are simple steps that you can take at home. Eat right, low salt diet, low fat diet, physical activity, try to reach a healthy weight and stop smoking if you smoke. If your doctor has prescribed you medication, please take your medication as prescribed. Do not stop any heart medication on your own. Always work with your healthcare provider, your healthcare team. It can be very dangerous for you if you stop taking any medication abruptly by yourself, especially your heart medication. If you start having any type of symptoms with it, if it's making you sick, it's giving you headache, any concerns that you have, do not be afraid of your doctors. Do not be afraid of your nurse practitioner. Do not be afraid of the healthcare team. They are there to help you. You are the most important team member on your healthcare team. But if you don't voice your concerns, if you don't talk to them about the issues and stuff that you are having, they will be limited in how much help they can give you. All right. So this is just some simple steps again that we can all take to live a healthier life and have a healthy heart. So again, how are you caring for your heart? We are in the month of February, so for the every week in this month, I will try to bring you guys, certain tips or something related to heart disease, so we can pay more attention to our heart. And the key is living a healthy life, eating right, physical activity, stop smoking. And then in all things, we pray and ask God to help us where we are weak. So I hope this was helpful. Thank you all again for listening. I hope my background noise wasn't too distracting for you. Mommy can't hide. There is no hiding place for me. No matter where I go, they find me. I think they can pretty much sniff me or smell me wherever I go. So I apologize again. You all have a blessed and wonderful day until I see you again. Bye. Thank you so much for your support. Take care until we meet again.